Welcome back to the deep dive. We've got a really interesting stack of patient education materials today from Carey Family Dental, and we are looking at something that usually makes people cringe just thinking about it.
Yeah, I mean, tooth extractions, it's definitely not anyone's favorite
No,
appointment.
definitely not.
But looking at these notes, the goal here is to sort of strip away that horror movie vibe and look at the actual mechanics, like why do we pull teeth? What are the biological risks?
And the systemic stuff.
Right, this is the part that surprised me, how removing a tooth can actually impact your heart or, say, hip replacement.
That connection is wild. We'll get there in a second. But first, extraction is just a polite way of saying removal. Why are we even doing this? Because dentistry is usually about saving teeth.
100%. It's usually the absolute last resort.
Yeah.
According to the source material, it really boils down to three main scenarios.
Okay, what's the first one?
First, the tooth is just too damaged.
Yeah.
So decay or trauma has just completely wrecked the structure.
Sense.
Two is overcrowding. Think of your wisdom teeth.
Mm,
There just aren't enough seats at the table.
right. And the third scenario involves infection.
Exactly. If the nerve dies and that infection spreads to the gum and the bone, sometimes you just have to cut your losses to protect the surrounding area.
It's triage, basically. You lose the battle to win the war.
Yeah, well put.
So let's look at that war, the systemic stuff. The literature mentions bacterial migration, which feels like a crucial insight for you listening.
It really is. We tend to think of the mouth as this totally isolated ecosystem.
Right, like it's cut off from everything else.
Exactly. But when you extract a tooth, you are momentarily opening a direct line between that oral bacteria and your bloodstream.
So the bacteria just hitches a ride.
Precisely. It enters circulation. Now, for most of us, our immune system spots it and handles it. No big deal.
But there's a specific group where this is actually dangerous.
Yes. The notes specifically highlight people with artificial heart valves or artificial joints.
Because the bacteria can colonize that artificial material.
You nailed it. Artificial parts don't have the same immune defense as living tissue, so that bacteria can latch on and cause a really serious infection.
Wow.
That's why you'll see dentists prescribing pre-op antibiotics for those specific patients. It isn't about the tooth at that point. It's about protecting the heart or the new hip.
That really contextualizes why the medical history form is so long. It's not just nosiness.
Not at all.
Now, moving from the heart back to the mouth, what about local risks? The documents mention dry socket, which sounds incredibly unpleasant.
It is very painful. Essentially, after an extraction, a blood clot forms in the socket. That clot is your bandage. It protects the exposed bone and nerves underneath.
Okay.
If that clot gets dislodged, maybe from suction or smoking or even just drinking through a straw, you have a dry socket.
So you're basically leaving raw bone exposed to air and food.
Right, and that requires a trip back to the dentist to get it packed and treated.
Ouch.
Yeah. The other local risk to flag is nerve proximity.
This is the numbness issue they mentioned.
Yes. Some roots, especially in the lower jaw, sit right on top of the nerves that supply feeling to your lip and chin. The extraction process can bruise or disturb that nerve.
But the notes say this is usually temporary, though.
In the vast majority of cases, yes. It resolves in about 6 months as the nerve heals. But the literature is honest about it. In rare cases, that numbness can be permanent.
Okay, so we've established that while routine, this isn't risk-free. Which brings us to the decision matrix. If you're sitting in the chair, how do you know if you really need this?
The key takeaway here is that you usually have options unless the tooth is fractured below the bone. If the structure is okay, they can restore
And if the bone is solid but the nerve is dead.
root canal.
Got it. And for gum disease, they mentioned periodontal surgery.
Right. If you can reduce the disease around the tooth, you might be able to keep it. The dentist is constantly weighing the integrity of the tooth against the health of the bone.
It's a trade-off, balancing retention versus systemic safety.
That is the bottom line. A healthy mouth is a gateway to a healthy body. Sometimes that means keeping a tooth, and sometimes, for the sake of your bite and your blood, it means letting one go.
It's a fascinating reminder that our teeth aren't just inanimate rocks in our heads. They are plugged right into the whole system.
Absolutely.
Here is a final thought for you to mull over. We focus so much on the cosmetic loss of a tooth, but if the bacteria from that infection can travel to your heart, isn't the gap in your smile actually the safer option compared to the time bomb of an infected tooth?
This audio overview was generated using AI for educational purposes by Carey Family Dental and does not replace a consultation with your dentist.